Hello everyone, my name is Irina Bonder and I am medical oncologist. Today we will talk about self-examination of the breasts. I will provide you with clear step-by-step instruction on how to properly examine your breasts so you don't miss anything important. Also, I will highlight the symptoms you should pay attention to. Did you know that breast cancer is the most common type of cancer among women worldwide? That is why the early detection of this significantly increases the chances of complete recovery. The simplest and the most essential method of diagnosis is self-examination. Although this procedure is widely talked about, only a few truly know how to perform it correctly and what to look for. Self-examination involves manual feeling your breasts. Every woman starting from age of 18 should perform this examination monthly. It allows to immediately identify any problems that may arise. Visual part. Stand in front of the mirror with hands down by your sides or place your hands on your hips. Then raise your arms up. Carefully examine your breasts. By doing these movements, any possible formation in the breast will become more obvious. What you should pay attention to. First, has the symmetry of your breasts changed? Has one breast become larger than the other recently? It is normal for up to 20% of women to have asymmetrical breasts with a difference of up to one size. However, if changes in the symmetry of your breasts have occurred recently, you should consult a specialist. Second, vein pattern. If the visible of veins has increased recently and is accompanied by redness in that area, you should consult a specialist. The third, skin color. If you have found a redness or swelling or possible appearance of a lemon peel texture on your skin, you should consult a specialist. The fourth, skin dimpling, also known as umbilication symptom. This symptom occurs when the skin of the breast appears to be pulled inward in the particular area. If you notice this symptom, consult an oncologist, please. The fifth symptom, nipple shape and the skin around it. Pay special attention to nipple inversion. Many women have inverted nipples for a long time, which is within the range of normal anatomical development. But if this has recently occurred, especially on one breast, and surrounded by redness in that area, it is essential to consult a specialist. And the last one, nipple discharge. You can detect nipple discharge by gently squeezing the nipple from the both sides. Also, pay attention to the inside part of your lingerie, as traces of your discharge may be present there. Now, let's move on the palpation part. To perform self-examination properly and not to miss anything, imagine dividing your breast into 4 quadrants with the center as the nipple area. With all circular motions, examine every quadrant of the breast clockwise or opposite direction, making sure not to miss any part. The breast area covers a significant part of the chest. From the upper part, it is from the second rib to the lower edge of the breast, which is approximately 7th or 8th rib, and from the medial and lateral parts, breast area extended from the inner edge of the sternum, which is in the middle, to axillary region. Stand in front of the mirror, raise your right arm up and place it behind your head. With the flats of your fingers of your left hand, gently palpate your entire raised breast, starting with the light, slow movements, as if you are just stroking the breast. Then proceed with a little more pressure, step by step examining your breast thoroughly. However, you shouldn't hurt yourself. If you feel pain during the self-examination, it may indicate that you are applying too much force. Avoid pinching or pressing too hard. Your movements should be smooth and gentle, as if you are applying lotion to your body or cream to your face. Finish your breast examination by checking your nipples. Gently squeeze the nipple from the both sides to check for any discharge. Repeat the safe self-examination process for your left breast. You can also perform the examination while laying down with your arms raised up or resting along your body. To complete the self-examination, check your lymph nodes in the axillary area. Raise each arm to approximately eye level and with the fingers of the opposite hand, gently examine your axillary area using moderate pressure. If you notice any changes in your breast, such as lumps or changes in texture, it is important to consult a doctor immediately. And thus, during self-examination, you should familiarize yourself with your breast. So, what can you feel during self-examination? For menstruation women, glandular tissue predominates in the breasts. It can be compared to a cluster of grapes, varying in size from small to the size of chicken egg. Normally, the glandular tissue is not painful during self-examination and has a moderate level of mobility and indistinct borders. For menopausal women, fatty tissue predominates in the breasts. This tissue is softer and usually more homogeneous. By regularly performing self-examination, you will quickly become familiar with feelings and appearance of your breast. You will be able to detect any changes that may occur. I wish you good health. Thank you for watching this video. Subscribe to my channel and leave your comments if this information was useful for you. Take care of yourself. See you in the next video.